We had a very spirited table, and I think we just need to start running on down. So what about the speaker's talk most struck you? It was about the need to engage and be proactive, making sure that we maintain the viability of the hospital, transferring decision-making beyond the system towards the customer, the consumer, the patient, integration of providers with the community, and I'm not sure I remember why the system is so weak. I'm sorry, whoever that was. But I think that maybe the most important thing that we came up with was that we and some of the people at our table were surprised at the lack of concrete solutions that we have or don't have right now for all the problems that we face. Question number 2. Ideal healthcare system. Integrated practitioners. Everyone working together. Integrative.
Yeah.
I'm sorry. Integrative practitioners taking into account every aspect of health on staff at the hospital. Access. Making sure we've got access and affordability. Medicaid expansion. Quality and safety, of course. Better outcomes. Changing from a fee-for-service model to a more outcomes-based coordinated care model where everybody works together, all the providers, insurance companies, doctors, hospitals, to make things work. A patient advocate or a patient coordinator to help many of the people that don't really know how to navigate the system or frankly might be a little afraid to discuss things with doctors or how to navigate the system, to have a human person to be able to do that. I can see Julia's smiling at me in a big way on that one. And then making sure that we have a range of services, telehealth, things that link us to things that we can't do well in this community. Next, I don't even know where I am time-wise.
10 seconds.
Primary obstacles. I think one of the main primary obstacles. Wait a second. One of the main primary obstacles we came up with was misalignment of financial incentives for providers and physicians and insurance companies and everybody in the system. Trying to make sure they're aligned more properly for patient care. Physician-owned facilities, TOPS. They wanted me to make sure I said TOPS. And ignorant or obstructive political leaders. We'll talk about this later, but some of these issues are higher than our pay grade here, and we need to make sure that our elected officials are aware of those and are trying to make the right decisions. Communication, lack of access again, and Medicaid expansion. Communication between the community and the hospital and the patient, doing a better job of just informing everybody what's available, what services are offered, et cetera. And then finally, this was an important one for one of our retired physicians, closed minds of providers. Physicians need to be a little bit more open-minded in listening to other views and other ideas. And our location and our climate, I'm not sure what that was. And then finally, what steps can we take to address this? We need to lobby our elected officials. I already mentioned that because some of these issues are greater than just our region. We need to lobby against ACOs. I don't know who put that in. I don't remember that.
ACSs.
Oh, ASCs. ASCs, I'm sorry. Duplication of services in a small community like ours. Educate everyone on the issues in the healthcare system today and how to deal with them. Create a community wellness center, a place not just, maybe it's the hospital, maybe it's somewhere else, maybe they're integrated together where people can become healthy and learn about what they need to do to stay out of the hospital and not be sick. Create a model that works not just for us, but other communities like us. We can't do everything well, we know that, but let's do what we can do well, create a model and try and export that. And finally, a board member said, come to St. John's Medical Center. So I think, am I in my three minutes?
You did great.
Thank you. Appreciate it, everybody.
So we tried to combine our various thoughts into a couple of key areas. We talked a lot about consumer choice and education, transparency around costs, really educating the consumer more. We talked about philanthropy in the context of partnering more with the community and really educating the community around and collaborating with the community. And then this, I think, came up because it was a surprise to so many people, the ASC threat, maybe something that a lot of us hadn't thought about before. In terms of our B, how we envision, We talked about access to specialized care, really assessing the need and where we could fill the need, knowing that there would be times that we could have to go outside the community, which would bring us to the referral and partnership piece and building the network. Patient-centered came up quite a bit, talking about patient-centered care, patient-centered, the navigation, the environment being more patient-centered, and the economics, so the costs and all of that, as well as wellness and prevention. And then trust and building that there is more of a better community relationship, so looking at that community piece and building trust between the hospital and the community. Our challenges, we talked a lot about lack of insurance in a couple of different ways. Because we have an employer-based insurance system, because of the seasonality of our community, a lot of people go without insurance. There's also a lot of uninsurable people in our community, so the demographics of the community play into that. This one was the hardest one for us to pull together. The cost of living in our community is a huge one, as well as the cost of care. We decided that's not a Jackson-specific thing, that is a national problem. So those were the biggest challenges. And if we look at solutions, we talked a lot about education and dialogue, and again, connecting the community and the hospital in real ways and partnering with them. We did talk about the state on the back part, the legislature. There's some places where we can make some progress with the state, and there are other places where we probably won't, so we need to look at what we can do as a community to provide services, facilities, and we even talked about the idea of a community health plan. And then promoting wellness. And that goes back to the education and dialogue, but really promoting wellness, and in the process of the education and the wellness efforts, really maintaining the visibility of the hospital throughout the community and continuing to build those relationships.
Questions. I'm just going to go through and try to summarize what we came up with. For question A, what about the speaker's talks most struck you? The group was really struck by the complexity, and that's the complexity of how all of the issues that we're addressing today kind of start here in Teton County and trickle up and down, up to the state level, to the national level, and then also down through the demographics of our community. And that led us to conclude that we really were pretty short on solutions today. The other thing that the group was really struck by was the importance of ongoing community education, and also the community understanding its responsibility and the necessary level of involvement with this issue, and really asking the question, who is the community and how do you comprise the community? Then the second question, as you envision an ideal healthcare system in the Tetons region, what qualities will it have? First and foremost, we said access, and talking about the importance of understanding the financial barriers to access, also the availability of services. And our group had a really interesting discussion around what are the core provisions that we really expect a small county hospital like St. John's to offer here, and what kinds of specialty care are better received in other communities, and how can we streamline having that specialty care offered in certain manners here in this community. We also talked about, of course, dear to my heart, broad-based education for wellness and prevention, and personal accountability for our own health. Then for question C, in your view, what are the primary obstacles to having an ideal healthcare system in our region? We noted the cost of care, and really just the cost of living in Teton County, whether that be housing, whether that be food, or whether it be cost of care. And then also the lack of legislative support. And then lastly, what steps can the community take to address those obstacles or improve the health of our region? We spoke about the importance of broad-based community health programs, working with our community partners throughout this incredible area. Also working with the Wyoming Hospital Association. And then another point that we thought was worthy of note was to really address some of the billing issues that were raised today.
We did it, folks. We solved all the problems. And then it went ran out of time. The next comment that we had was that for A, one of the talks that struck us most was that there was no apparent solution. After that, it runs into ditto in response to everybody else. Complexity, financial viability, competition in the workplace, patient-provider transparency, more communication between providers and patients needs to be accomplished. Honesty, if you will, frankness, forthrightness. We're moving in that direction thanks to Julia and this whole community function, but we're only at the beginning of the community action that's happening. Part B, ideal healthcare system. We need to bring in the outliers, those people in the community who are not serviced by healthcare right now, and we need to ask them if they want to be part of it, to find out. I suspect they probably do, and we had a couple of folks who worked at the hospital who assured us that, yeah, they come into the hospital. The minority groups, the poor, the transients, the homeless, all those folks. We need to provide the service we can, and we need to look at sustainability, care for the entire population. We need to be holistic, look at wellness. Access was a huge one. How do you get people into the hospital? Somebody should be able to call in Teton County and say, and know that they can have access to the ideal system that we're talking about. On the third one, primary obstacles. Those of us at our table felt that regulatory issues were a very, very serious problem. I'm not sure that there's much we can do about that, but there are federal, state regulations. Just, you know, there are American board regulations that restrict a lot of healthcare delivery and misdirect it. Some of these regulations are interfering with face-to-face time with patients. I'm sure many of you are aware of that. You go in to see your doctor, and he's sitting here typing like this and never really looks at you, doesn't spend a lot of time with you. There are presses on providers to see 6 patients an hour, for example. You can't teach somebody in that period of time. Who's going to take over that teaching obligation? You know, it's probably going to befall to the wellness center because docs don't have the time, nor do they have the interest, and far too often they're incentivized to see more patients because they get more money. So the system has its real difficulties. It was brought up that patient volume is not necessarily sufficient to provide all of the services we provide. That has to be looked at very carefully and balanced in the community. The point being, I guess, there's a fixed cost of opening the door, and that's your job, Lou. You know, well, no, you know, balancing that. Personally, I think you're doing a good job. Balancing patient education with community expectations, and that's where I really like Jonathan's little formula, satisfaction equals reality minus expectations. You can come up with a negative score in that formula. And in the same vein, well, it's not really an obstacle, but we need to pay attention to accountability to quality. And interesting, what can we do to address these issues? Someone pointed out we need one courageous person to start the process. And that one courageous person could be Julia, it could be this whole group of people. But someone needs to step forward, and I think we're stepping forward and moving in the right direction at this point. We need to continue the forum that's been begun today. We need to educate the populace and patients, and again, perhaps a new model of education that gets away from practitioners who really are squeezed hard. Thank you.
To start with what struck our group, every one of the speakers was very good at articulating the issues that are so complex around healthcare. And I myself have been to several different talks and conferences the last year, and you really did a good job. It is very hard to explain so much of what's going on. And we also talked about now taking that out of this room and to the general public. The community collaboration was amazing. Again, congratulations to Public Health and all of those 40 some odd organizations. The influences of cost, we talked about going from this whole volume to value system and what that means for hospitals and what that means for communities and what it means for individuals. The second part, what qualities do you envision? Access to preventive health care is a huge, huge piece of this. And the collaboration to provide preventive health care, because we've talked today about health means many, many things, whether it's social, economic issues, or just plain access. Robust educational opportunities. I think every group, we would agree that that's probably the first thing we can do. Support in navigating the healthcare system. How do we help those who can't help themselves to navigate the system? Even those of us who are educated and up to date have trouble navigating the healthcare system, whether it's with bills. And then transparency on all levels was the fourth one there. The third group, what are the primary obstacles? We talked about the regulatory climate, the bureaucracy, the legal system, the complexities. There's a lot of pressure on everybody. The next thing was, I guess, investing the community in their own health. Again, this idea that we're all in it together. We have to educate people about health literacy and how to advocate for themselves. And it's no longer the doctor just telling the patient what to do. The patient now has to be an educated, I hate this word, consumer of health care, but it's true. And then the last one, what steps can we take? One of the things we talked about was prioritizing our needs and being realistic about what we can do, what are our resources, and how in a small community do we address the things that are most important to us and use our dollars most effectively. Again, that whole equation. A lot of public awareness, education, and participation. And last but not least, my favorite, patient-centered continuum of care. And that really, really encapsulates everything from the minute you enter the healthcare system as a newborn until you go out at the end of life. If we have a system that is patient-centered, we found out, we also have great value in that system. And I know it's not really easy to articulate why that is, but we do know that's true. So again, that last one, patient-centered continuum of care. Keep that in your mind. Thank you.
Okay, we pretty much, being table 10, ditto everything everybody said so far. Pretty much a lot of the same discussion, but we took the instructions that Jonathan gave us and we actually came up with a statement for each of these questions. So I'll read the statement, and a lot of the background that people have already said went into this. So our group, for the first question about what struck us, there was kind of a theme about the hospital needs to be a dynamic community partner and resource for the community to provide excellent local care for all. And we are seeing that with the partnerships that have occurred in the last a little bit with public health and the community health needs assessment. What does an ideal healthcare system need to look like? It needs to be a collaborative process with all parts of local systems of care to provide a central resource of available services in the community and make that accessible to the public. We had consumers at our table that didn't know about a lot of things that they heard today. So I think getting that information out to the public is something that we need to work on. What is our greatest obstacle facing our healthcare system? We feel it's the recruitment and retention of qualified and experienced healthcare workforce for wages that can't compete with the cost of living in Teton County and affordable housing. How in the future will we build that system if we can't recruit and retain our workforce? The last question about what steps can we take for the future. I think this forum is a great example of moving forward. One of our participants said, think outside the valley to find evidence-based ideas to deal with the continuity, the continuum of care from preconception to end of life. through community education and ongoing collaboration among our systems of care. So we summed everything up in 4 statements that we'll leave with you today.
It is clear to me from the conversation, not only at my table, but many other tables, that when it comes to dealing with the issues of health care in Wyoming in a rational fashion, the Wyoming legislature totally sucks, and I take full responsibility. Having said that, you're welcome. It gives me great pleasure. And then once again, before I get into Jonathan's actual instructions, there were 4 themes that kind of ran through all of our answers. One was the nature of competition in terms of private sector competition with the local nonprofit hospital, but that there were pros and cons to the nature of competition. The second was the issues regarding wellness and prevention services. The third, the issues regarding insurance access, and the fourth, education. So now, to get to Jonathan's actual instructions, what struck us about the speakers, the first thing was essentially the profit and loss nature of the hospital business and how reimbursements are allocated, how providers might have to reduce expectations, cost allocations. The second was essentially the triple aim concept. And the third was role of prevention and wellness programs. What qualities an ideal healthcare system would have in Teton County? Once again, a very good preventative care and wellness program, integrated case management of the medical home concept, and improved access to care with improved access to coverage. The primary obstacles, once again, we go to the competition issue and the impacts of private entities, but also the benefits that sometimes competition can give us. Insurance issues are obviously a problem, both options for insurance, and then once you have it, the transparency of the program you have. And the third are just the general demographic, geographic issues that being a rural community creates. And then what steps the community can take. We started out with the broad concept of outreach, whether it is the notion of clinical outreach, where we have a hospital as a hub and creating outreach access in the more rural parts of the community, and also educational outreach, particularly talking about teaching patients about patient choice, patient accountability. And the other piece was emphasizing partnerships with not just within the hospital and the medical profession, but with the other community resources that are available, and understanding the responsibilities of all of those components.
What struck us most, I think one of the main things was the ASC, the effects of the profit-making surgery centers on the hospitals, and also the question about why would they be succeeding when we already have an established hospital. That was a big query that came up. The concept of hospital as trusted resource, which we thought was one of the ways that you sort of counter some of that effect of the ASC. Patients, the whole concept that patients are now making more choices, that they have more of a role in their medication, in their medicine, and also the shift into the value care form of compensation, as well as the concept of certificate of need, were ideas that several of us had not heard of before. What did we envision? Streamlining the navigation through the system, greater transparency, this whole idea of branches of access, both with records that go back and forth between different branches, whether you're the emergency center or whether you're the core of the hospital, those records go across, and better access to patient portals of information so they can see the information themselves. Telemedicine also being very important to provide other specialized information in a smaller community such as ours. A team approach to improving care instead of somebody bouncing from doctor to doctor, again with a little communication, little records shifting around, and little communication between the doctors themselves. Better preventative care, elder long-term care, including Alzheimer's information support, but that whole piece I don't think has been discussed as much. And then the need for strong private support. If you're going to have a community hospital, the old base was it was coming out of a religious center or from strong community support, private donors, and we need to be able to continue with that in order to have our community hospital versus the profit-making concept that is coming strongly into our communities. Obstacles, obviously the rural smallness of our community, the geographic situation we have, plus this flux in population from 3 million people passing through in the summer down to a small community of maybe 10,000 people. How do you plan and organize accordingly for what your resources are? Defining satisfaction. We have a very intense community that's come in from other very sophisticated places, and they have really high expectations for the quality of care. Some of them then go back to those sources. Thank you. And so people go back away to get some of their medical attention, but these are also the same people who are potentially the private donor source. So how do you match those up, both on the sort of upper level of things, but also on the lower level? What are we really expecting for our medical service? Pricing, the lack of disclosure, you don't know what the heck you're going to be paying for or how much. The language, economic, and social disparities in this community, which many of us sort of are unaware of, and that needs to be factored in. Recruitment of talent, how do we get the really good doctors? That was also mentioned. Housing costs, all of that affects how we can get good people in for that high quality of care. And then legal impediments to connecting doctors to the hospital, surprise, surprise. Finally, what should we be doing? Steps, politician education, community education, especially in the newspaper about these values that the community hospital provides. We're learning we don't know a lot about this. Social media to do that. Neighborhood leadership in these communities where we want to have preventative and greater wellness support, including this Hispanic community. And finally, preventative care.
I'll just bring up the points that I felt that our group came up with that are different than what we've already heard. Our group thought it was really interesting seeing Jonathan's first graph showing that people in making the least amount, their wage has not increased, but people in the top 5%, their wage or what they're earning has increased dramatically. And then how with healthcare costs increasing, how that affects people making different incomes. We thought it was also great that there is this forum today where we can get together and just discuss healthcare issues. I don't think that's really happened before. And I know it was mentioned once, but the ACS and the quality and the cost of that versus at the hospital. Is there a difference? Things we heard today. We dreamed big at our table for envisioning healthcare system. We would like to see all alternative and preventative therapies being covered by insurance companies so that individuals can choose if they want Eastern medicine approaches, Western medicine approaches, and make it more of an individual's choice. Full coverage to all parts of the population. Increase in the hospital safety rating to an A safety rating, transparency and clarity in cost and coverage for health insurance, and making providers and the hospital all in your network, so there's no out-of-network costs. We were dreaming big. Oh, and we also wanted to focus on wellness as a whole, the whole human being, spiritual to exercise to illness. Then we talked about the obstacles, which seems like there are many after this discussion, but some that we brought up that were not brought up is cultural competency. What works for one resident in Teton County probably isn't going to work for some of our other residents in Teton County, and how can we alter the approach to work for all of the residents and kind of realize that not one resident or socioeconomic status is going to work. Changing policies at the state and national levels to then hopefully trickle down to more of a local level. An obstacle is our population base, and then costs of living and things like that were again brought up. To address these obstacles, we thought the fact that the health assessment occurred was really great. That's the beginning, seeing what are our problems and identifying them. Community discussions, making sure that people have a voice to say their opinions. This is a great forum. In-network and out-of-network clarity. People understanding how to use the healthcare system. And one of our solutions was to create a community healthcare advocacy program. I think it was mentioned before, but some employers are using that, and it's a really great way for taking the pressure off the individual and giving them some assistance to manage and weed through all the different phone calls you could potentially make for your healthcare.
Thanks. So table 16, likewise, I'm just going to talk about where I think we have something unique to add. In the discussion about all the complexities that are in healthcare, I really think we had a nice conversation about the role of the individual as being an informed consumer and an active citizen, that was really imperative, and we were really asking a lot about sick people to understand all of this stuff. We got into the nuances of how healthcare is funded, and at the end of it, we're like, and if you have cancer, you have to deal with all this stuff. So I think that is, that's the thing that struck us about the talks. Higher?
Yeah.
I don't know. I can hear myself.
Yes.
Okay. You want to hear me that loud? So then number 2, or access, I guess it's letter B. Had the usual conversation, but the one thing we talked about that I haven't heard from anybody else was mental health and the role of that just being a big overlooked thing. And we actually had someone at our table trying to get access to mental health in the communities and talked about, or in this community, and talked about the barriers to that, which included pages and pages of work, and basically there being a greater demand for mental health than supply. The obstacles that, this is my pet theory, but I just take highly regulated industries like phone companies, cable companies, and just think as a consumer how terrible they are to deal with. And there's just a lot of regulation, a lot of bureaucracy in that. And then I think that times 10 is what we really have for healthcare. And so, having events like this where we learn and we're engaged and those sorts of things, that it's just incredibly challenging. And I was probably the most pessimistic person at our table. So I think the optimistic people in the group reminded me that, hey, this is our role and we have to deal with this stuff. And so we're thankful for the engagement that we're having here and that we need to continue to have to do that. The last one, what steps as a community can we take? The really important one, I think that, again, we haven't heard as much is the expansion of home care and those sorts of things into the community, that getting out there and engaging people, not just when they're sick and not just in wellness programs, but getting out into homes was important, and then continuing work like this. Thanks.
We talked about, for question A, what struck us most is there's a real need for more coordination and more cohesiveness within the system. So from government to insurance agencies to providers to patients, and also within the state of Wyoming. We had a discussion about surgical surgical centers, which I think a lot of folks already talked about. And then this was interesting, the importance of discussing these issues with objectivity. And I think our presenters today did an excellent job kind of discussing where we're at and where we need to be and trying not to let the politics get into it too much. For our ideal healthcare system, one thing that hasn't been brought up is caring for our aging population and chronic conditions. So that was one of our key points there. And then also thinking about really continuing to develop strategic partnerships and including integrative care and wellness into the future. And then for obstacles, we again talked about our aging population and how we've got an influx of retirees coming into the community, and so how do we address that? Regional isolation, economic and social disparities was a big part of our conversation, and then limited tax revenue in this state as well. So in addressing obstacles, one really great solution was really tapping into our community resources, those retirees who are moving to our community, who are retired physicians, those sorts of things. How can we really tap into them and utilize them and all of the other talent in our community as much as possible? Additionally, we talked about Medicaid expansion and really continuing the interagency dialogue, and along with that, following up on the needs assessment. So we know what some of our issues are, and so how do we now take action to start to address those?
5 hours, 4 minutes. So we're a couple minutes over, but we had a mic that didn't work, so we've got an excuse. I thought it was an extraordinary day. It was, you know, as Lou talked about, it's a never-ending process of transition, but we have to start somewhere, and I think this was an extraordinary start. I hope this can become an annual event, and if to that end, again, please leave your seats on the table, but if you have any thoughts about future themes that we could focus on here in a similar vein, there's so many different ways, so many different ideas that have come up, and I really, one of the challenges and opportunities for us as an organizing group is to figure out a way to capitalize on the energy in this room and the thoughtfulness and the passion that we have, not just for this place physically, but for this community of people about whom we all care so deeply. And there's so much opportunity here, as Brian suggested, for us to become a model. How do rural communities look out to the future and transform themselves in a way that honors their rural character, but also honors the fact that we're becoming increasingly interconnected financially, information-wise, and in every other way with a bigger world. That's a real challenge for special, isolated rural places like this. And if there's any place in the world that can figure that out, it's Jackson Hole, Wyoming. And so on that note, thank you so very much for coming. It's been a great day, and we look forward to continuing the conversation in ways that we'll have to figure out over the next several weeks and months. And there's Mike Q.